Humans make mistakes. When things go wrong, the most important thing to safety is to have a culture that encourages everyone to identify the underlying causes and prevent these similar incidents from happening again. Unfortunately, there can be a tendency to blame the person who is most closely involved with the incident. Punishing people without changing the system only perpetuates the problem rather than solving it. The culture of healthcare in the past focuses on placing the blame on healthcare providers whenever there was an error or bad outcomes occurred. With this kind of culture, healthcare providers were hesitant to report the errors due to the fear of punishment. Nowadays, the focus of the healthcare is patient safety and just culture. This balances the assessment of the systems, the processes, and the human behavior when an error or incident is reported. Just culture refers to a safety supportive system of shared accountability where the organizations are accountable for the systems they have designed and for responding to the behaviors of their staff in fair and just manner. In turn, staff are accountable for the quality of their choices and for reporting both the errors and system vulnerabilities, as it is very important to learn from these errors and utilize the lessons learned in designing a system for error proofing. On the leadership patient safety walkaround findings, it was identified that frontline staff need to work in an environment where a just and fair approach is standardized and implemented, utilizing the appropriate corrective measures combined with an additional opportunities for learning and awareness on the application of the just culture principles. On these walkarounds, positive responses to non-punitive approach to errors were 66%. Whereas 43% positive responses on the same composite was also identified as an opportunity for improvement based on the assessment of the Patient Safety Culture Survey conducted in the facility during the first quarter of 2019. Thus, the Just Culture integration to incident reporting was initiated with an aim to have an objective system for the assessment of incident reports and to develop a high level of trust among the frontline staff and the management with a widespread adaptation and deployment of the Just Culture principles. This project was sponsored by the Quality Council, which emphasizes to all directors the importance of role modeling the safety culture concepts and encouraging the supervisors and managers to actively participate in the project activities. Stakeholders were engaged from the beginning of the project to understand their challenges through the focus groups, various campaigns, safety rounds, education sessions, committee meetings, as well as engagement of the department safety officers. Ideas for changes, evidence-based practices, and team thinking innovations were visually mapped before embarking on the improvement work. Team members were also assigned specific change ideas which will impact the primary and secondary drivers to achieve the project outcomes. Staff behavior choices and appropriate action responses adapted from the Leonard and Frankel model were added to the incident report form, which shows a measurable and innovative way to adopt the standardized and fair process of incident decision making. These Just Culture guidelines and principles were also added and incorporated to the relevant policies. Various campaigns were conducted to promote the Just Culture throughout the organization. Top reporters of near miss, no harm, and unsafe conditions were recognized and rewarded by our Chief Executive Officer, and good catches were also recognized by the leadership group. A 6 full-day workshops with competency assessment on the science of safety and just culture were conducted for the supervisors and managers of the nursing, rehab, and medical affairs departments. These initiatives and changes were the driving factors that led to the following outcomes. 85% of supervisors and managers participated and were trained on the Just Culture and Science of Safety workshops, 100% of which are from the pharmacy section, followed by 95% of supervisors and managers from the rehab, 78% of physician heads, and 76% of nursing managers and supervisors. All reported incidents were categorized according to the risk behavior choices and the system-level factors identified. The percentage of non-punitive approach to error based on the leadership patient safety walkarounds improved from 66% to 91% positive responses. The average number of monthly incident reports also increased from 153 to 239 reports during the project in comparison to our 2018 data. In addition to achieving the targets, positive impact of the project to the quality, economy, political, and social are the following: improved staff attitude and knowledge about risk, effective care delivery, enhanced volumes and improved efficiency, and positive patient experience. Safer care significantly reduces cost, insurance premiums, and improves return of income on safety investments, as we can also avoid higher use of resources and administrative burdens. City efforts toward the National Transformation Program will be demonstrated, as this acts as a positive reinforcement for policymakers, giving priority to patient safety initiatives. This is also a potential game changer for the organizations. Socially, effective healthcare provision is a key metric by which the social fabric and prosperity of a country is measured. Improvement in the documentation of intravenous fluid in the HIS, enhanced fall prevention education and carryover skills from nurses to patients, standardization of food consistencies definition, adaptation of fracture assessment on post-cast removals, prevention of dressing-related tension blisters, and redesigning of tasks on the cassette exchange process on medication preparation and dispensing. To ensure sustainability of the project, we added behavior choice and action responses as a field to the SOTAC incident module. Adopting this approach to SOTAC has the potential to improve the reporting culture and deployment of just culture guidelines across the healthcare organizations within the kingdom. It is a measurable and innovative way to adopt the standardized and fair process of incident decision-making. Just culture workshop attendance and IR categorization were also added as a mandatory competency for all supervisors and managers as an element on their annual employee performance evaluation and recontracting processes. Incident report KPIs were added to the indicator dictionary, including near-miss rate, percentage of incident categorization by risk behaviors, and percentage of incident approach according to just culture. And lastly, the changes were incorporated in the relevant policies. It is essential to strengthen trust and improve incident reporting that will identify system weaknesses and opportunities for improvement, which will also build maturity towards the organization's direction of adopting high reliability organization concepts in alignment with the organizational quality improvement and patient safety plan.
We believe in just culture.
Speak up for patient safety.